Uh, this is how healthcare works today. Every year, more than 20 million patients are booked with the wrong physician. This is called a scheduling binder. When you call into a medical practice, someone has to triage you to the right physician, check their availability, verify your insurance, and also choose the right appointment type before booking you through. Clearly, this is a very paper and pencil process that's prone to mistakes. What's even worse is that the average American waits more than 35 minutes on hold on average to talk to someone. This is critical as 88% of appointments are still booked over the phone. When patients can't get a hold of someone, they either turn elsewhere or what's worse, they won't get the care that they need. We partner with customers in rural areas, federally qualified health centers, where patients used to literally drive into the practice because it would take an hour and a half to actually get through on the phones, and it's way too frustrating. At Assort Health, we're tackling this head on. To date, we've served over 300,000 patients with our AI agents. Before starting Assort Health, I was head of product engineering at a $6.5 billion health tech AI company where I built one of the first generative AI ambient scribes that's now being used by hundreds of thousands of physicians across the country. My co-founder, John, has 7 publications on the intersection of healthcare and AI, and also went to UCSF med school before dropping out to start his first health tech company. And we're going to serve millions more patients this year. That's the goal. Uh, that is sort of health. We're silencing the ring music, the whole music forever, and making sure that no patients get booked with the wrong doctor again. In terms of our product, we've really made patient care navigation much smoother and less frustrating. We've dramatically reduced hold times. For that client that used to have an hour and a half wait times on Monday, it's under a minute now. For our practices, we help to reduce the operational overhead and admin work that's involved to run patient access centers, while also increasing the number of net new patients that they're able to see and number of appointments booked. This directly turns out to be revenue. So we, cut their costs and increase revenue. And overall, our UX has been rated very highly out of patients. And that's just a small difference in the performance of our AI agent can be millions of dollars in reimbursements for our practices every year. Yeah, so we're really heads down focused on making sure that our AA agent had at least 95% resolution rates for engaged patients before really hitting go to market. In October of 2024, John and I hired the first BDRs, and John and I became account executives ourselves. So didn't have earrings when we were going around selling the doctor's egg. And we've really accelerated, we've had 8x growth in ARR since late last year, 170% net dollar retention by upselling new products and by handling more and more calls for our customers. Our vision and our mission is to make exceptional healthcare accessible anytime, any place for anyone. We're doing that this year by scaling up Assort OS, which is a fleet of highly customizable, specialty-specific generative AI agents that will facilitate or automate any interaction between you as a patient and a provider or practice. We're really raising the bars in healthcare, and please, find Kelsey or Elaine on my team to see how that works in application. I like to say our team has a very quiet intensity and just getting stuff done when we need to be really heads down. We're also a really fun-loving team that's super ambitious, mission-driven, product-minded, and really hardworking. But we do have really fun offsites where we'll go to Tahoe together. We're going to go to Hawaii to celebrate our Series A. So there's a lot of the fun stuff involved to bond as well. We're hiring across the board, mainly really focused on engineers. So if you like healthcare and you're a great engineer, please text me and please come say what's up. After the presentations. Thank you.